All right. Hello, everyone. And I see we have somebody online. So it is nice to see you here, too. My name is Jackie Werner, and I am the Scholarly Communications and Research Librarian here in Philadelphia. So today we're going to be going over Policy Map. And Policy Map is a fairly new database for us. And what you could do with it is it has a lot of different data sets. Freely available data sets, a lot of them from the government, and some proprietary ones. And you can use these data sets to make a map. And then you could also make like really nice reports really easily based on geographical location. So this would be really useful for community health. There's really obvious applications, but anything that you're looking at that will have a geographical component, I encourage you to take a look at Policy Map and see what it could do. So first of all, I cannot actually see any sort of chat from anyone who is watching remotely. I have been told I can see chat remotely by clicking here. Excellent. All right, so I will try to check back occasionally and see if there are any questions. All right, so first of all, to get to Policy Map, you want to go to the library homepage, library.pcom.edu, and then go to Collections and Databases, and P for Policy Map. Then you just scroll down. And wherever O is, there we are. Okay, so I have this open in another tab. And this will ask you to log in, whether you're on or off campus. Same access either way. All right, so here is what Policy Map looks like when you first log in. And you'll notice up here there are 5 different options. We have maps, which is what we're on now, tables, reports, 3-layer maps, and data loader. And we'll be going over all of these. So with this map, you can basically treat it like you would, say, Google Maps. Just move it around, and then you can use a scroll wheel or this over here to zoom in. That's a little closer than I like. There we go. Let's see if we can navigate over to Pennsylvania. All right. So here we are. And actually, if you click satellite over here, you could look at it next to Google Maps. So, all right, let's try to get out of the forest here. So instead of trying to kind of navigate my way here, I'm going to do things the easy way and type 19103. Wait, which one are we? 19131. All right, and you have zip over here. All right, and there we are. And you can see on the left we have Policy Map, on the right we have the satellite view. So let's turn this off for now, you know this. All right, and there's a couple ways to get your to get a specific. You can actually type the address. As soon as I start typing, I've forgotten everything about our address. Philadelphia. I swear I can type. And that sends you right to the address you want. Other things you could do, if you click on location, you could look for specific, look for other ways of looking at location. Here we have congressional districts. So let's go down to Georgia, for instance. And then you can just find, you know, what district you're in. just click that, and that sends you right to the district and outlines it. You can also do school district. So let's get out of California. Anyone know a school district in Pennsylvania?
Librarian.
All right.
Got your camera ready to spy on someone?
Oh. All right, Lower Merion School District. Takes you right there. All right, so now we know how to get around the map. So what do we actually do with it? What we want is some data. So all of these selections up here are different types of data that you could look at. So we're going to look at health, because that's obviously of some interest to us. And then there are three different types of data. First, you have data layers, and that is looking at areas, and it's going to be coloring in those areas by these different scales. For instance, for infectious disease, seasonal flu activity here. Then this is right now. You can see this is all the same color because it's shaded by state. So let me actually find something different. What I'm trying to find is something shaded by, say, county. All right, let's do the immunization. Okay, so here we are. This is shaded by census tract, city, county, state. Let's do county. All right, and if we zoom out a bit, then you could see all these different shades here. I'm actually going to go back to census tract because it's a little easier to see. And over here on the left-hand side, we have our data key. It tells you what each of these colors means. So for immunization, we have 34.79% or less, all the way up to 45% or more. So that gives you an idea of what the range of flu shots looks like. You can also change different colors here. And that's if you just, if you're doing a presentation, for instance, saving this data, and you want a different color scheme, here you go. I'm going to go over to blue because it's a little bright. All right, and then ranges. So you could actually change the different ranges if you want. It's set to 5 categories, 5 different colors. You could make more categories depending on how granular you want this to be, and you can also set exactly what you want these ranges to be. So let's just go to 3. Make it really simple. So it starts at 16 point something percent. Let's go 16 to 25. Then 25.01 to 40, and then 40 to whatever the highest is. And then now we have 3 colors instead of 5. All right. So once you're here, you'll notice that this is still pointing out the Lower Merion School District. Click on that. All right, it'll just zoom in. Usually when you click on that, there we go. All right, if you click on a particular area, it will tell you the exact data you're looking at. So for instance, at this exact location I clicked on, you can see that you could see it going from the smallest area to the largest area. So this census tract vaccinated 50.24% of adults. You can see it's in the 40% or over, and that's pretty good. Then you could see if you're clicking here and you mean just the county, Montgomery County, that's going to be 43.7. Pennsylvania as a whole, going to be 39 point, I can't quite see it. And then United States as a whole. So you can go as granular as you want. And And all right, so we've looked at data layers. Let's look at data points. All right, I'm going to go back to health here. And you could see that this area over here says data layers. Now, under data points, the difference with data points is that they are full points. And you'll notice that a lot of these are just specific locations of things that might be of interest. For example, if I hover over hospitals, you have hospitals or Medicare certified hospitals, nursing facilities, community health centers, and lookalikes, retail-based healthcare. There's just a lot of different options that you can look at. Farmers markets. And if you look at, you're not always going to be looking at health-related points. If you look at all these other data points, then there are a lot of options. So let's go for four-year colleges and universities. And I'm going to zoom out a lot so you could actually see something. All right, and if you look over here in Philadelphia, you can just about see that cluster of universities. So I'm going to go back to a location here. All right, and I'm going to go to 19103 so that we get closer to that clump. All right, and here you could see that little dot. Click on it, and it tells you it's the Academy of Vocal Arts, institution size, and there's actually a lot of information about it. All right, so basically you can have one data layer at a time and as many types of data points as. So let me go back to health over here.
Can you do community health centers for me?
Yes.
If you don't mind.
I'm going to click on community health centers. And we're going to click the first option here, if I can use this trackpad correctly. There we go. All right. So let me actually get rid of this data here so that it's a little easier to see. And all right, I'm also going to get rid of the universities. Do you have the approximate address of one of our community health?
Dr. K, what's the like the Lancaster Avenue one?
None of ours are FQHC.
Oh, was that the data point?
Yes.
Oh,
So they will not appear. Right?
We
Yeah.
do have
What's the other
community
one?
health centers and lookalikes.
That one.
That's quite a way to put it.
West, up,
All right.
yeah, west and up, Lancaster Avenue.
All
Oh,
right, up.
there you go.
Okay. All
Uh,
right. Come over here.
going up Lancaster.
30 seconds.
I am having a lot of difficulty with this trackpad. I apologize. All right.
What street is it? What street is it?
42nd.
There's 44th.
Right.
We're not a look
First.
We're not even.
You look alike.
because we're private.
Actually, let's click on the source and see how they got this data. So this is a premium subscriber data set. And this tells you exactly where this data is coming from.
Oh, HRSA. Read. And HRSA.
All right, and it looks like this was updated October 2019. So this is how we can discover which data sets we have to pay attention. And you can also filter points by searching for something.
Okay, you search by health center?
Yes. I'm going to search for osteopath. All right, looks like I'm not seeing anything. PCOM. All right. So it looks like we're not on this data set yet. But let me just throw in Philadelphia here. And that'll take you to one that I searched for. Again, lots of site info here. And So here is an interesting option. You'll see that there is an option to see radius report. I'm going to click that. And okay, radius report, never mind, I'm going to come back to that when I do reports. But I'm going to move this over here. And I am going to create a region. So right now the regions are basically what Policy Map offers at the beginning. The census regions, counties, etc., existing regions. But if you click Create a Region, and then Radius Region. All right. Click OK. And I'm going to put a radius right smack on Rittenhouse Square. And you can see it's 0.5 miles around Rittenhouse Square. I'm just going to name this Rittenhouse Radius. Description, don't really need one right now. All right, and now you could actually get reports, and when you're narrowing down your data, you could have it just in the region. So you can actually put in custom data points, including, say, our community health centers, and then put radiuses around them, and then compare them. Say, what is the opioid prescription rate around this health center compared to this health center? All right, and I'll go into more of that later. You can also create your own region just by you can just draw where you want it to be, or you can do an assembled custom region. Say you have several congressional districts that you want to look at. You just say assembled custom region, and then click each of those districts that you're interested in. Then save it all as whatever you want to look at. All right, so do we have any questions about kind of generally using this map? Okay, I will check chat. All right, no questions there. All right. So let me actually look at some more data again. Going back to health, and let's do opioid. Overdose on all specified opioids. All right. So here it looks like this is shaded by county or state. So I'm going to zoom out a bit. If we could get some different colors in here. There we go. All right. So you can see what the county rate looks like compared to each other. All right, and it looks like Philadelphia is looking pretty good. The lowest number of deaths in this data. And then again,
Philly is the lowest?
Yeah. That's
right.
All right.
Or is it still thinking where?
It looks like Philadelphia County, 2.8 per 100,000 people.
That's interesting.
That is very interesting.
So Delaware County, which is this purple one here, what's that?
Click on that. That is 29.9.
Right.
Does Philadelphia know what they're doing?
Right.
Or they don't report it?
I am really interested in that and why that Philadelphia data is like that.
Oh,
you
or they haven't reported it yet. Or
yeah.
something.
You could find out, well, as you can see, Policy Map is a really good way to kind of look at the overview of things.
They tell you where they get the data from?
Yep. So this data is from going over here, source CDC. All right. This looks like that CDC, and that tells you all of the
Right.
all of what they're looking at.
So go back
Mhm.
under
Back
health
in there.
data. So you said opioid. Do they have shootings?
Let's see. All right, that may or may not be under health. Let's right here. Was that sound like quality of life? All right, searching. This is a perfect time to search. Good idea. All right, so up here, you'll see there's an option to find, and that is where you search for statistics that you're interested in. Oh, right, isn't the CDC like not allowed to study that?
Yeah, well, they're not allowed to study it, but I don't know if they can't track it, but I guess you're not finding anything.
Yep. So unfortunately, that is not on this database. All right, please. DOJ.
Oh, the
All
number of
right.
robberies.
Yeah. All right. Let's
I
go
saw
with
that.
robberies. Come on.
We are.
Number of robberies, aggravated
There we go.
assaults.
Murders.
There you
Yeah,
go.
we don't care.
We assume they're done.
All right.
Well,
There we go.
Then Philly is appropriate.
How many were there?
Well, it's 9.4 or more.
All right. Now that we found the worst statistic for Philly.
Oh,
All right.
really?
All right. We definitely have that under health. So for overweight and Ooh. All right. Come on.
We're pretty good.
No,
Yeah.
we're
33.
32, yeah.
we're at the top.
So you could take
We're
Philly,
still-
you could do your own custom one around like the family clinic here on City
Yes.
Avenue. And what was the rate? The radius is always 5 miles around?
You could change it to whatever you
Whatever
want.
you want.
It's
Okay.
it's automatically set to 0.5 miles, and
Oh,
you just
okay.
change
You
to
change it.
whatever.
Okay.
So, for instance, let's get rid of universities. But something like obesity around community health centers. But as we know, correlation is not causation. Oh, ooh, maybe a chat here. Yes, you can import your own data. Well, you can import your own address data, which I will be talking about later. So basically, you can import the data points, but not the any of like the range data. However, if you want to do that, Tableau is able to make very nice maps using your own data. So if Policy Map doesn't do what you want, then definitely ask me about Tableau. I've done some presentations about it, and they have some real nice mapping data in there. All right. So no, I don't want your newsletter. I'll click that. All right. Oh, new chat. Oh, that's very helpful. You're welcome.
Can you import Tableau data into this?
No. You can all you can import is .csv or I think Excel files. So basically the same spreadsheet data you'd be putting into Excel. All right. So once you have this map, you can download or share it in a lot of different ways. All right. First of all, you can print it. And it gives you a very nice map that actually like fits to the piece of paper. You could have a PDF version or a PNG, so you can easily insert it into, for instance. And you can also actually download the data itself. So if you think this data is interesting and you want to do more in-depth analysis of it, you can download the layer, the points, or everything, the points and the layer data. Then you tell it what location to download for, which is either you could add a predefined location such as your zip code, Or you could use any of the custom regions that you've saved. Then it'll just email you the data once it's all together. All right, then you could actually share it. Maps with custom regions cannot be shared. All right, so we can't share this particular map because it has a custom region. But if you have a map that's based on any of the regions that are given in policy map, that includes just going to an address and then including like the county, for instance. Then you can share it online, and it'll basically work just like policy map itself does. You'll be able to they'll be able to like zoom in the map and play around with it. They'll be able to click on the points and get the information about it. And the only thing, so about 80% of the data is available freely. For instance, the government data. That leaves 20% of the data sets that you can't actually share. You can still say the maps, save the data. You just can't actually publish it to the website. And you can get an iframe, which you can put on websites. So just have a little mini policy map in there. Zoom in to where you want, so they could click on the things, and it's a really nice interactive option.
How do you reference? Do you reference policy map or do you reference the source?
That's a very good question. It's possibly both. Yeah, I'll have to look that up. Oh, luckily.
That's what I
Wait
thought.
there, that's exciting.
Yeah.
Oh,
All right. Thank you, Policy Map, for having very clear instructions here.
But
All right.
academic research, there you go.
Okay, so it tells you, yeah, exactly what you're using in there.
awesome.
All right. Okay, so that's how you save the data. Now we have some pretty interesting uses not based on this actual map, still on locational. So let's start with tables. And tables are exactly what they sound like, tables. All right, so I'm going to, right now it's not showing anything, and we will see why in a moment. All right, so I'm going to look at something different here. I want to look at opioid use by state. All right, so I'm just going to type in opioid instead of trying to find it in there. All right, deaths from opioid rate of deaths per 100,000 people in 2017 from the CDC. All right, so here there's nothing, it only says sample chart because we don't have an area selected yet. We choose the years that we're interested in. If the data has multiple years, the latest year is good, or you could just have everything. Let's try across years here. If it will let me click. All right, either my mouse or policy map does not like that, so we're just sticking with 20. All right, let's do a location. Pennsylvania state. And let's compare this to New Jersey and New York. See? All right. So now you just have a nice table comparing all of these. And yeah, and it includes the state rankings, which is nice. And if you click on, so we're looking at state right now, but if you click on see values for counties here, it'll show you more granular data. I honestly don't know why this is white on black, but that's what you have to deal with. And then you can just, you could download this data or save it as one of your, as some of your preferred data. We'll click on see rankings. you see the rankings for states. There's Pennsylvania. The worst one is West Virginia by a big margin.
Yeah.
All right, and down at the bottom we have New York and New Mexico. Oh wait, no, there's multiple pages. Down at the bottom we have Nebraska. All right, and the thing about using the tables is that sometimes the area that you're looking at is going to be too small for this. So let me get rid of all these states. For instance, if there's no data tabulated for zip codes, then it's not going to be able to show you anything. But let's type 19131 zip. And here you could see no data. And that says area too small for aggregation. But it tells you that it touches 2 counties, the values. So you can either look at Montgomery County or Philadelphia County. So let's throw both of them in. Start typing Philadelphia County and Montgomery. And that's a big difference. I'm going to get rid of the zip code here since it's not showing anything. And then you also have the ranking of, which is all counties in the U.S. and also includes top 10 and bottom 10.
Again, West Virginia.
You're in the bottom 10.
That's interesting.
That's very interesting. All right, so basically what you have to remember is if it doesn't show you anything, then just click and see which larger options you have to look at.
So, so there was nothing in 19131, right? But if you did like 19104, is it just no zip codes, or you just have to play around with it?
Yep, it's no zip codes because counties is the lowest granularity this particular statistic looks like.
Gotcha.
All right, and now I was able to click across years, so you can see just how that's changed. It starts from 2000. You can't actually, but they only started looking at it in 2008. But you can see how the rate has really spiked in Montgomery over here. And then you have the individual data over there. All right, so then you can just, oh yes, and if you look up here, it tells you what it's looking at. Click on that, and then it gives you a description of what this exact data is looking at and how they got it. And then over here, if you click on the source, you could go to the actual data set. So you can also click this on map and get the same information on the variables you're looking at. All right, any questions about tables? Okay, there are the same options as on the map, except you cannot share them. This one is either, I think it is free data, but you just aren't allowed to share the tables. But since they're not really interactive, you can just save the image and put it on whatever you're interested in. All right, now reports is really fun. All right, so reports are giving you a very thorough, very nice looking report on these particular data sets that our Policy Map has collected them and think they all. And you may be interested, especially in the community health report. So let's start with the county here. And anybody know what county South Georgia is?
South Georgia. It's Moultrie.
The county seat.
Let's click Moultrie and see what happens.
That's not the name of the county.
Dang it.
That sounds right.
All right, we're gonna do some Googling.
Oh, yeah.
Moultrie.
Lonnie's Gwinnett, I know that, but
All right. County seat. Polk
Oh,
Creek
yeah, it
County.
was. I just didn't know how to spell it.
All right, I'm copying that because I can't type today. And I'm just going to search for Oakland. There we go. All right, so community health report for predefined location. We are starting with a map, previewing the report area. Moultrie's right in there. And then just click generate report. So this does take a while to load, but scroll down. You can see there is a lot of information in here. Yeah, population change, age, race and ethnicity, and here comes the health information. So we have healthcare and well-being, access to health insurance, and we get medically underserved areas, which is, of course, the reason why we're down there. You can see this is definitely a medically underserved area. And then you just have lots and lots of information about that.
Which is from CDC?
Each one will tell you where the source is. So most of these are CDC. It says the source for each individual data point. And since these are collections of different data sets, each one will have basically different information.
how about births?
Births.
Is there one for births?
All right, looks like we just have infant mortality on this one, but
Yeah.
I'll show you that might be in the community report, which I will show you shortly. All right, and here you have farmers markets, food security. So there is a ton of information, and each one of these graphs or tables that you want to get, you can download the information. You could download the actual data, download just the image here, or just go over to the data set. Like this one, for instance, is from the census. Yeah, and the healthcare community health report is in beta, so it is still actively being worked on. But even if it's not completely finished, there is a ton of information you could get in there. And you could also download the entire report. Just save here, print, and then, or just save it as one of your favorites. And then since you have to log in to get here, you'll be able to access everything that you want. You could even create a project to organize all of your saved data sets, tables, etc. based on one of your projects. All right, let me run back to reports here. Also really useful is community profile, which this seems more likely to have dates in there. And here you can get a radius or a custom region. So this does not have to be like only a county, city, etc. So let me go to radius here, and let's type in 4170 City Avenue, Philadelphia. Can't type today. Philadelphia. Yay. All right, we're doing 0.5 miles. Let's change it to 1 mile around. Okay, search for that. Yep, that's exactly what we're looking at. And let's generate the report. All right, so this is what the community profile report looks like. Again, tells you if the data shows not applicable, then it tells you the reasons that might be. It tells you what it's served by or touches is part of. For instance, there's a lot of state house districts in this mile. And then here we have population trends, racial characteristics, age distribution. Do we have births? I'm guessing births just doesn't look to be part of these reports. This is definitely something you could either contact Policy Map and say you'd like it in there, or we could just search and see if that's actually any of the data that they have. So over here, let's search for birth. Yep, we have number of births in 2017. Yeah, according to the C ranges, let's store defaults. Okay, so the default is just 3 different birth ranges. It's a lot in Philadelphia. All right, so do you have any questions about using reports? All right, last thing we could get, well, 2 last things we're going to look at. First is 3-layer maps. And 3-layer maps let you choose, let you basically narrow things down with an AND search. So you're looking for any locations that fit this specific criteria. So let me get back to City Avenue in Philly. All right, so we're zoomed in here. And you could actually just click the report, see the report right from the map. All right, so right now I want to look at incomes and spending. So we want per capita. All right, and right now, when you first start this, everything is going to be purple because everything is being selected. You are looking at per capita from $32 to 100,000. All right, let's go instead 60 to 100. All right. Okay, and you know this right now. We have fewer purple regions. Click on one, and it'll tell you why it's not included. Per capita 27,000. Over here, per capita 61,000. All right, so we have that. Now let's add something else in there. I'm going to look for flu shot. All right, there we go. Immunization. All right, and again, everything is automatically included. We have 16% to 66% vaccinated. So let's change that from 16 to 45. All right, wait for that. And now we're down to a smaller area. And you could see this one has the per capita that fits and the percent vaccinated that fits. This area has the per capita fits, but the percent vaccinated, 49%, does not fit in there. And you could also add a third data layer and search for a third option to narrow it down to these. All right, questions about this? All right, so this would be good for something, say, just if you're looking for the intersection of 2 things, just play around with this and see what you can find. All right, last thing we're going to look at before questions is the data loader. All right, so the data loader can be used to add points. And there's 2 ways to do that. One, you can just add points directly to the map. You can just click on the map and say, all right, there's something of interest here. The name of data set. All right, PCOM clinic. All right, and then you choose who it's going to be accessible to. You can make it private, so only you could look at it. Accessible to selected individuals, so put in the emails of everyone on your team and they can see it. Or all university users, so anyone at PCOM can see these points you've added. So let's say myself only for right now. And then you can choose whatever icon you want. Which options, just begin adding points. So then you would enter an address. So let's just put in ours because it's the one I actually prefer. Philadelphia, PA 19131. All right, then title, PCOM, Philadelphia. Then there's a description. You could actually include an image and then just save that. So this way is a little more hands-on. What you probably want to do if you have a lot of data is just upload a spreadsheet of points. So then it'll show you what the data set is going to look at. I'm going to put PCOM clinics in here, accessible to myself only, and then import CSV file. And it gives you here spreadsheet tips and a sample spreadsheet. So let me download this to desktop. And this, for instance, would be really useful to have the list of PCOM clinics. So then everyone will have an available filter or an available data points that is the PCOM clinics. Click that, and then all the clinics will show up on the map. So this shows you just how the just what geocoding is going to look at. So you need the specific address, address to, city, state, zip code, and then you put any other information that you wanted there. So if you want to be comparing these data points, you can put just put anything that you wanted there, like the year that it's founded, the number of staff working there, etc. And then they'll be able to see that as soon as they click. And again, if you want to look at different data sets that are not in here, for example, you have the data that you collected yourself with geographical data, then you're going to want to go to Tableau to put that in yourself. What Policy Map is best at is using all the data that they've gotten together and using these data sets to look at wherever you want, wherever you're interested. And the data uploader is good at putting in points that you know you're interested in. All right. Any questions about that?
Question.
Yes.
You wanted to upload all the locations for all the third-year students.
Yes.
Which platform would be better, Tableau or Lois?
I think this would be, well, it depends what you're doing with that data. If you just want to have a map with all that information on it, then honestly, either one of them would work.
Because it'd be nice to know at a location, work with campus group, how many topics are there? A group, how many are doing?
All right, that sort of data could be done with either of them. I think this might be a little simpler to upload just that, since this is just for maps.
Do you have a file you can share? Test it out for you.
I'm sure Elite has multiple.
So it would have the student name, it would have the name of the facility, you said the rotation name? I mean, what are the data types of, like the fields?
The first level would be if it's a work limit versus J group.
Yeah,
Then
both of them.
Number of total students, J group, then you get granular and go down rotation by specialty by specialty.
This one you can look. You might want to start with Policy Map because they have hospital and healthcare centers information already. So in that case, you would just be able to like add the student and location, and then they'd be able to click there and see the existing data.
What about mainline health system that includes 4 or 5 hospital.
But so was there something under hospitals?
Yes.
Under community,
Let's take a look at what the information on hospitals looks
So
like.
Light Health.
health, there you go, health facilities, hospital. Oh.
All right, let me look for hospitals. Then I could search for main. All right, hospitals. Okay, and now once you're in here, search for mainline. All right.
Do like and all.
All right.
Is that spelled correctly?
Wait, anyone know how to spell Lincoln now?
Yeah.
All right.
Do main line with a space.
Ah.
There you go.
There we go. All right, so here we could see. All right. I'm not sure.
There's like an at the bottom.
Yeah, I'm not sure why that didn't want to show up with it. If you're not finding something, I guess try a
Alternate spelling.
yeah. Or capitalization. But yeah, so this information already on here, it tells you like number of beds, yeah, if there's any medical school affiliate. And then the staffing. Or it can just disappear instead of clicking on staffing. There we go. All right, so some of it has insufficient data in here. Basically, it depends if this data, existing data, is of use to you, or if you'd rather enter your own data on there. And yeah, that would really be the difference between Policy Map and Tableau for something. But yeah, if you send us or if you get us to a sample of the data, then we can basically like whip up a map in both the report on how difficult it is and what features you get. Either one can create an interactive map you can embed somewhere, and also images that you could just put in a presentation. All right. No problem. Any more questions about Policy Map? All right. Well, thank you all very much for coming. Everyone here in Philadelphia, feel free to pick up some free swag. And anyone watching, just send me an email at jaclynw, JACLYNW, @pcom.edu if you'd like some free swag. We have a few notebooks, lots of Sharpies, pens, stickers. All right. Well, thank you all for coming.
Thank you.
Okay, let's stop recording.
Get up there.
I need
Please stop recording. Oh, stop sharing. Now stop recording.